Hey guys, Troy here with Cape Ann Conversations, and today we've got a local not-for-profit, Build Health International. We've got Samantha and Rosanna. I'm going to pass it over to Samantha. Maybe give us a little introduction on your role in the organization first, and then we'll let Rosanna tell us about her, and then we'll dig in.
All right, sounds good. My name is Samantha Morrison. I am the Senior Procurement Manager at Build Health International. My role is really to procure construction materials and ship them overseas and trying to get things onto the job site quickly and efficiently and making sure it's the correct thing to build the healthcare infrastructure that we're working on.
Perfect.
Hi, everyone. My name is Rosanna Niosi. I'm the Communications and Marketing Manager at Build Health International. I've been there for about 3 years now. I oversee all of BHI's external channels, so anything basically with BHI's name on it, the website, social media, these beautiful annual reports that you have in front of you, Troy, and also get to collaborate with our incredible team that is all over the world to really showcase the impact and stories of BHI. So it's great to be here today.
Thanks for coming. Samantha, give us a little history lesson. If we're looking backwards at the start of Build Health International, tell us how it got started, where it got started, the origin story.
Yeah, absolutely. So Build Health International actually really came from the Haiti earthquake. So our founder, Jim Ansar, who's actually a Essex native, he saw the effect that the Haiti earthquake had on the local population and wanted to make an impact. He has a lot of knowledge in the construction industry. He sold his company in Boston and had a desire to make the world a better place. And so he actually saw what was going on down there and decided to spend the next few years traveling back and forth to Haiti and building the hospital that is actually still standing and still one of the largest hospitals in Haiti to this day. And so he is our founder and kind of our vision and the person that we look to what we're doing today and how that vision of what we did in Haiti can expand around the globe.
So you talk about that in Haiti. What year was that
It
when
was
you started?
2007.
Okay.
2007 was the start.
And you finished that project in Haiti, and now where are you primarily focused?
Yeah, our primary focus right now is really in Sierra Leone, but we do work all over the globe. Our main focus right now is working in under-resourced setting, resource-constrained settings to build up the healthcare infrastructure and really provide a level of knowledge that may not already be there. So we go in, we work with various partners that find locations that need this healthcare, need these resources, and they say, hey, this is the work that we think we can do. BHI, can you design and build a hospital? Can you go in and train the local population? So we go in, we train, we send the construction materials there, we build what we need to build, and then we, find the next project that we need to go to.
Yeah.
And our expertise ranges in architecture, engineering, construction, both administration, management, facilities management. So once the infrastructure is built up, we can provide that expertise as well. And it's really meeting the needs of the partner that's on the ground, like Samantha mentioned. So some projects can be multi-year, multi-million-dollar hospital facilities, and sometimes it's as small as maybe fixing some equipment that might be malfunctioning in a hospital and training local folks on how to repair that equipment and identify and troubleshoot as needed. So
Yeah.
it really ranges.
Yeah, because we not only build new hospitals, we also repair and improve upon what's already existing in those locations. So right now, one of our largest locations in Sierra Leone, which is the 161-bed hospital project that we're working on, it's a maternal center of excellence. That is what we call it. And so we not only are building that, but we're also building the warehouse that'll support the people there. We're also building the dormitories and training centers, which is where the doctors and nurses will live that'll work at the hospital. But not only that, being a new project, we also are working on an infrastructure project for the already existing hospital that has been there for years. So we are working on a number of locations just in that one small space. But yeah, it's a lot of support as many places as we can.
So by now, everyone that's listening to this is going, Okay, these guys have built hospitals across the world. These guys are fantastic. Number one, they're all thinking that. But number two, they're all going, how did they end up on Cape Ann conversations? Because Sierra Leone's a long way from Cape Ann. And this is the magical part that a lot of people around here don't know. And this is what makes this podcast so great is that you guys have two locations right here on Cape Ann, one in Beverly and one in Blackburn Circle. Maybe you can distinguish what's going on at the two.
Yeah. You want to take it? Oh, okay, cool. So we do have an office located in Beverly in the Cumming Center. If you ever are around there, wandering around, you might find us, by perchance or perhaps intentionally.
When you get lost in the Cumming
When you
Center.
get lost. But essentially, we have most of our USA team based out of the Beverly office. Architects, engineers, construction folks, all working from that space. And then we also have we just moved into 22 Blackburn Circle, which is our 30,000 square foot warehouse facility that essentially is the hub for so many of the materials that we actually send to our project sites in Sierra Leone, Haiti, Rwanda, countless other locations. I'm going to let Sam actually talk a little bit about warehouse because
Yes,
that's her
Yeah,
expertise.
tell
that's
us
what I
about,
do.
like, tell us, number one, it's a 30,000 square foot facility.
Yes.
But, immediately I'm jumping to why do we need a 30,000 square foot facility here? Tell everybody that part of it because I think that's part of the call to action as well. It's like this is a staging ground of getting equipment and parts to make this all this magic happen.
Yeah. So as I mentioned earlier, one of my main jobs is finding and utilizing donations from places like Boston Children's Hospital. So, people that are redoing their hospital, people that are working on construction projects, they have, sometimes leftover materials that they can't use anymore. That's where we come in. We will go to their job sites and we will take a look. If it's something that we know we can utilize and we know we can ship overseas, we'll take it and we will bring it up to our 35,000 square foot warehouse in Gloucester, and we will then palletize it and put it in a container and ship it overseas to where it's needed. So I think that's an important thing to remember for everyone in the local community. While we are an international company, we are a very local company. Like we're in Beverly, we're in Cape Ann, we're in the greater New England area looking for donations that we can utilize, whether it be construction materials, whether it be biomedical materials, anything and everything. You might think it's waste, like you might have leftover tiles from a project. We're happy to come look at them, see if they're a good quality. If we can use them, we will. So our 30,000 square foot warehouse may seem large, but we filled it up very quickly.
Give us an example of some of the stuff you got from Boston Children's.
Yeah, so the hospital beds are a big one. They actually donated a lot of hospital beds.
Yeah, because what good is a hospital in Sierra Leone without
Exactly.
beds
Yeah.
to put people
Kind of the
in?
key location, yeah. And then also biomedical equipment. So we have incubators from them as well. A number of things.
And you have to
X-ray
get all of
machines.
that together in some staging area to make it efficient to get it to its end place. And it's right here in Blackburn Circle.
Yeah.
And we were talking about this before the podcast. You guys are employing like 60 people from in and around Cape Ann here locally, but potentially hundreds of people when you talk about the actual project in Sierra Leone, the actual building. And then there's countless other people donating their time for doing training sessions on how to fix this or that, or implement this tile or whatever it may be. So there's a lot of people benefiting from economically from the projects that you're working on as well.
Yeah, not just in the U.S., but all over the globe. We have contractors that are in Kenya, South Africa, all over the place, but specifically focusing on Cape Ann. Yes, we do have all our architecture team, our project management team is right there in Beverly, and the level of knowledge that we have there, I always say I love it because I work with people that are so much smarter than me. So any question I might have, they're great. They know what they're talking about, and they're a core group of people that we have in Beverly that are that want to make the world a better place. They want people to know about healthcare infrastructure. So they take their level of knowledge, whatever level that may be, whether they've previously worked on, in big architecture firms in Boston, and this is their second or third job. They're willing to take that level of knowledge and just distribute it to anyone who wants to listen. So that's something that our call to action is we want more people that have that level of knowledge to share it. We're always willing to listen to new ideas, and the healthcare infrastructure world is constantly changing. I mean, there's always new technologies, there's new ideas, so we want more people to think about it and have those ideas and share them with the greater world as much as possible.
And we're continuously learning too. I mean, there's so much expertise at BHI from Jim's experience at founding Shaman Design and Construction, and some of the other architecture folks like Sam had mentioned. Having 30 plus years in the for-profit architecture space, though also understanding that the contexts that we're building in are so unique and different to what might be expected in the greater Boston area, and so continuously learning. Okay, what works, what doesn't work, what materials are readily sourced and locally sourced in Sierra Leone versus what do we actually have to ship to Sierra Leone, but also responding to the environment, but also trying to elevate the quality of care that folks can really receive through our expertise. So merging the best of both worlds,
Exactly.
Understanding and listening to the community, the partner about what is needed, and also just saying, okay, how can we, leverage all of this expertise to really deliver a fine healthcare solution. So that's really important to us.
So there's a lot of great people obviously involved in this project, but how does this all really happen? Like you mentioned, I think Partners in Health as a key partner. This spun out of almost, but how do you actually pull this off? I mean, this is a hospital you're building. This is millions of dollars, tens of millions of dollars, right? And technically, in what you guys are bringing in an infrastructure perspective, like how do you actually pull that together? Is it funding from state and local government? Is it donations? Is it grants? How does it really work?
Yeah, so our direct funding at this point is really partner based. So PIH, as you mentioned, is one of our largest partners. They've been with us from the beginning. BHI really spun out of PIH to begin with, but our funding is predominantly through our partners at this point, but that is something that is always a concern because, funding is not easy to get. So that is something that Rosanna, I will say, is extremely great at. Her and her team has been really trying to expand the level of funding and expand where we get the funding from, just to make everyone's lives a little easier in terms of, anyone who's worked on a construction project knows that it never goes according to plan. Your budget is always going to be overblown. You're always going to need change orders. So that is something that we're always actively thinking about. Construction projects are difficult. Everyone knows that, and especially when it's over an entire ocean. So yeah, we're always looking for that next opportunity, that next partner, that next grant, just to see where we can expand that base in order to support all the projects that we want to work on. Um,
Yeah, funding sources definitely have been diversified at BHI. Project funding definitely has been so much of the core of where we're able to get our projects done. At the same time, we've also really expanded our focus onto multilateral funders and partners. So we've worked with the Bill and Melinda Gates Foundation, we've worked with the Skull Foundation, the Global Fund, if folks are familiar. That's been a big part of our oxygen work, which we won't go into too much today, but also really critical. And then also just the individual fundraising and support that we get. A lot of our fundraising support is actually from the greater Boston, Cape Ann area too. So obviously to build this beautiful, what we are building, it is impressive, but at the same time, overhead costs are key, right? Like we need to fulfill those things. But yeah.
But you also have it like it's a project. So you're like, we're building this hospital. It's going to cost roughly this much with a 10% change order budget,
Mhm.
to make this happen. So it's very tangible.
Mhm.
So when you go to raise money, it's not just raising money for the ether of raising money to put it in some coffer. you're raising it and it's literally going directly to a tangible use.
Absolutely. And the cost effectiveness with the warehouse too is huge, right? Biomedical equipment is very expensive. Construction materials, Sam can tell you all about construction materials. It's so expensive. But even, contributions can be financial, but they can also be in kind. And that's where we have really the community support of Cape Ann and others. If you have construction companies that have, offloaded material that they want to ship off to Sierra Leone, you can have that material in Cape Ann in one moment, and 3 months later it'll be in Sierra Leone, which is an amazing thing just to kind of observe from this standpoint. So it really doesn't necessarily have to look like it's just a financial contribution as much as a material expertise, we've talked about as well. There are so many different ways that people can get involved that really do make a difference and an impact.
Yeah.
So I have to ask the tough questions too, which is why? Why do we help Sierra Leone and build hospitals in Africa? Like I think we conceptually can all agree that that's okay. That's right. Like it's a good thing to do, but why?
Why not?
Why not?
Yeah, I think that there are a lot of needs in a lot of places, and I think that that is a very valid argument. I think that there are a lot of places that could use the services that we provide. However, I would caution against that form of thinking because this healthcare is important. This will save lives. Sierra Leone has actually one of the highest infant mortality rates in the world. So that is actually where PIH saw that need, and that's where they wanted BHI to come in and assist because that level was so high, and it is so dangerous for mothers to have children. And I think everyone can agree that we have the technology, we have the ability to fix that issue, so we should. And I think that anyone who has any type of moral character would agree that that is a good thing. And I think that there should be more nonprofits like BHI out in the world. I would love to see 10 BHIs out there in the globe doing exactly what we do and providing these types of resources to places. There's plenty of places in the U.S. that need the support as well, but we are specifically focused overseas. We're specifically focused right now in Sierra Leone, and the work that we're doing is good, and I think that more nonprofits should be doing it. If I'm being honest.
Rosanna said something before we started today that kind of hit home too. It's you guys are really focused on building the infrastructure, the physical place for healthcare, and there's like Partners in Health, for instance, is focused on the almost like you could say the process of healthcare, but there's only so much you can do in a location to improve health outcomes without a physical place to perform it.
Mm-hmm.
And that's the key piece to why you guys are doing this and like where are you doing this and without it you wouldn't be able to improve that mother mortality or infant mortality rate. I forget which one it was. Which is an astounding number. What was the number?
So in the U.S. comparatively, I don't have the exact figures, so don't come at me too much, PIH. The U.S., so for every 100,000 births, 16 mothers will die, which is still high, but it's not as exorbitantly high as in Sierra Leone, which is well over 400. So 400 mothers for every 100,000 births will die. That's unacceptable.
So when you talk about why, it's like because there's,
yeah.
I mean, we can just decrease over 400 to 16.
Or lower.
Or lower.
Why not?
But we can do that with all of the existing technology that we already have in the U.S.
Absolutely.
Mm-hmm.
Maternal mortality is preventable. I want to say in majority of cases is completely preventable with the right equipment, with trained personnel, which is where Partners in Health really does support BHI, is with providing the clinical support, but also the infrastructure. So many of those births in Sierra Leone are happening at home, where if something goes wrong, again, very preventable cause of death, happens. And to have a facility that we didn't talk about this too much, but there's also a maternal waiting home and this MCOE project where mothers who are expectant often, have to travel very, very far distances to give birth. The maternal waiting home piece will actually allow them to wait. And, instead of traveling right when they're about to give birth, they can actually stay in that location in a safe space. So when the time does come, they can safely deliver their child, which is really impactful. So again, and we Sierra Leone also has a very tough history, right? Sierra Leone has been systemically oppressed, marginalized, it was colonized. It's a very resource rich country, but we know that a lot of those resources have been, shipped out elsewhere to other parts of the world, and they have seen no, return from those, um,
Hard
yeah,
hard labor and
yeah, hard
yeah.
labor, all exploitation,
Mm-hmm.
and so I think there is a global responsibility as well. Sam mentioning that there should be more nonprofits doing this work, absolutely, but the most important thing is that we're taking active steps through partnership, through expertise, through learning every single day to really improve lives and save lives.
Yeah, and I want to touch back on something Rosanna mentioned. Uh, this hospital is not only for the people of Sierra Leone, it's also for the surrounding countries. People will travel, you know, we in the U.S. take it for granted that we have a hospital right down the street, especially in the North Shore. That's very true. People will travel for hours and hours to get to a hospital. Like people will come for, 2 countries away just to go to this location now because it is such a uh, positive and impactful hospital and location. So we're not only just supporting one country, we're supporting a surrounding area.
And
Listen.
you're young. You're just getting started. You know, the point is though is that you've done it successfully. You've done it successfully in Haiti. You're doing it successfully in Sierra Leone. And you're just getting started and you're getting the word out now about who you are and how you help. And it's Sierra Leone today, but it's going to be, Rwanda tomorrow. It's going to be the next country tomorrow, and it's going to compound. And the more success you have, the more efficiently you'll deploy them, and the
Yeah,
more impact you'll be able to have. And you can get other countries potentially even involved because they can see your process and just mimic it because it's successful and it's replicable. It's not impossible.
yeah, yeah. I will say, like you mentioned, Rwanda. Rwanda has been a great support for BHI. Specifically the government of Rwanda is a huge partner for us. We may not work directly with government organizations. However, we do want to make sure that we are communicating with the local governments to make sure that we're not doing anything that is, out of bounds or maybe not in the direction that that country wants to go. We want to make sure when we go into a location that we are following the cultural rules, we're following, the ways that we want to go, but also bringing in, it is a Western company, so we're bringing in that level of knowledge, and we are trying to maybe raise standards in certain places, but we're not changing what's going on there. We want to make sure that anything that a local population is doing, we see that and we take what they're doing and we expand upon that, not change anything because what works for one location doesn't always work for another. So.
Yeah, because you're building this hospital in Sierra Leone, but you also are building the training center,
Mhm.
and so you're training local doctors and local, you know, workers of that healthcare facility, and so you're creating jobs there, but you're also creating this self-sustain, like teach a man to fish,
Yeah.
don't give a man a fish type outcome that is really the lasting impact.
Yeah, we actually just finished up a project in Nigeria working with Dr. Christian Happy, who's actually just one of Time's 100 most influential people. So we just finished a project there called ACEJID, and it is a research lab and university training center. So we didn't build the university or anything, but we did come in and we built the research lab, and they actually had they successfully completed the first COVID, sequenced the first COVID case in Africa at that lab. So it's something that we can tangibly say is making an impact. It's creating jobs. It's creating educational opportunities for people in those places.
And to name drop Sierra Leone too, one really cool thing about the Sierra Leone project, which is more recent, is that a lot of our Haiti team members, the ones that we trained over a decade ago in Mirbalais at the University
Hmm.
Hospital in the site of that building, they actually have traveled to Sierra Leone to train on the
Yeah.
ground with Sierra Leone workforces, which is
Wow.
incredible, right? So you're
Hmm.
seeing the ripple effect beyond Haiti.
Yeah.
We think about expertise, but our team in Haiti has become, a supreme source
Experts.
of expertise as
Absolutely.
well, which is really incredible. And, we'll see the fruits of that labor too kind of come to fruition. The MCOE project, the inaugural opening ceremony is happening October 25th. So
Yes.
be on the lookout for our social channels on that. But
Yep.
also, the first patients are expected to come in January 2026. And I think that will also only spur more economic growth, more opportunities for folks to, really get involved with this work and see how effective it is in improving health and saving lives.
Okay, so let's assume that somebody listening to this owns an architecture firm, owns a general contracting company, something to that effect. They can donate their time, their resources. Doesn't have to be money, but they can help in a second job. It doesn't have to be a full-time job. It could be just help in any way with your time, access, and resources. That's one. Number two, people can donate with money. So if there's local foundations or money managers of private wealthy individuals that do not-for-profit donations, they can donate directly to you as well. Um, if there's literal local workers, like if you want to work in a warehouse in Blackburn Circle, you might need help there. There's just it goes on. What's the best way if somebody's like, this is speaking to me, you know, international healthcare is speaking to me. I need to find something out. Where do they go? What do they do?
Our website is a great resource, but also come visit our warehouse. I
Yes.
think, sometimes saying come visit our warehouse, people are like, I'm not sure if I really want to
Like,
go
that
to a
feels weird.
warehouse. That's a little weird. But honestly, I think stepping into that space, even working at BHI when I did for the first time and just saw the magnitude of the equipment, the materials, and understanding that that was going to go to another site very far away from here, but here made an impact there. I think it's an incredible opportunity. So if you reach out to our development team, the email, it's very long, but it's development at buildhealthinternational.org. You can schedule a warehouse visit or you can just drop by. I mean, we're so local and we're there 5 days a week during the work week. So, I think it's a really impactful time to see really the scope and magnitude of what we do. You can see how we stage containers. You can see all the other materials out there. But we're just trying to, I think, make the world a little bit of a healthier, better, more dignified place. And you can do that right in your backyard
Yeah.
here in Cape Ann.
Yep. We're also on LinkedIn too.
We're on LinkedIn too. Yeah, huge LinkedIn following. Everyone loves us on LinkedIn.
Yeah.
And it's just buildhealthinternational.org.
Yes.
Buildhealthinternational.org.
It is really long. We're going to have to work on that. We're going to have to somehow get you BHI. I don't know who we're going to have to strong arm for that, but
Call the
that'd be a
internet.
huge win.
Googling is totally okay too.
Yes.
Just build
Yep.
health and international, and then you're all set. And we're the first thing.
Awesome. Well, I mean, you guys, unbelievable work that you're doing. It's undisputable, and it's just another testament to something in our backyard in Cape Ann that people probably don't even recognize that it's right here. So thank you both for being on here. Thank you both for telling the story. I hope to see more about Sierra Leone. If you guys want to take a podcast guy and a dry cleaning operator, which is what my day job is,
Yes.
to Sierra Leone, I'm game.
Absolutely.
I'll get to work. So thank you so much, both of you, for being on.
Thank you
Thank
very
you.
much.